with our host, Dr. Jack Rocco. Dr. Jack, what's going on, man? And let's go into this topic. I think this is so important because everyone gives up, right? When then they don't perform. And as men, we all had those times. And this is really a good topic.
Yeah, I've been dealing a lot with this over the past several weeks. And you're right. It is something that everyone deals with. It's embarrassing when it happens. It exposes some vulnerability to men and relationships. If a man can't perform in the bedroom, oftentimes digs into their self-esteem, and it also digs into the woman's understanding of, whoa, is it me? Are you not attracted? Is there someone else? So I've heard all these things this week, and I just want to go nuts and bolts, A to Z, kind of what an exam entails for me when someone comes in with issues on performance. How's that sound, Neil?
I love it. Let's go.
Great. Yeah, typically I've been seeing a lot of these guys in their 40s and 50s, and everyone comes in shy. And a lot of these guys, these are very athletic guys, older guys. They're still working, they're still functioning, and they come in with their tail between their legs, and we have them fill out their questionnaire, which goes into the history in detail. Are you able to obtain erection? Are you able to maintain the erection? Can you finish the job? Are you being pleased? Is your partner being pleased? That kind of thing. And often guys, they'll enter into one of the two categories. Either they can't get it up that's good enough for penetration, or they get it up, but then they're unable to complete. They start, during the process, they start to get a weak erection. So I start off with, a lot of the basics starts once again with testosterone, as testosterone has a big impact on this. And we've talked in the past about how testosterone is good for muscle mass and those male characteristics. And now we're honing down our evaluation of it into the sexual performance. So a lot of these guys, the first step will be to check a testosterone level as well. Because just the testosterone functions to kind of waken up the tissues, if you will. If the tissues if they don't have any exposure to testosterone, they won't necessarily respond in the way to stimulation or to produce the desired result. So the first step in all these guys is to check a testosterone level. And we've talked about this in the past, that the testosterone level is not just a hard, rigid mark. Oftentimes, it's more of a range, and people are different. It's different from person to person. But in general, if their testosterone level is below about 300, that is typically and absolutely defined as low T, okay? Between 3 and 400, 3 and 450, there's a soft range in there where if they're old enough and having enough symptoms, they may also have a low T. And the reason for that, we didn't really go into the reason for that, but a lot of it has to do with the amount of protein that an individual will have in their bloodstream. There is a hormone, there's a protein that's called sex hormone binding globulin, SHBG. Okay. Now, 98 or 99% of your testosterone is bound to this protein. So only 1 or 2% typically is left free in the blood floating around. And that's the free testosterone is actually the functional testosterone. So if someone has high protein or low testosterone, there's a ratio there of the free to total. But some of these guys who may have low testosterone levels or higher testosterone levels, but if they have a lot of protein, they could still have low T. So that's where the variability comes in. And sometimes that's a little above the scope of what I expect my patients to understand. But if someone isn't responding to testosterone, if the symptoms aren't resolving, sometimes then we'll go into deeper detail and look into the free total testosterone level, as well as the binding globule, the luteinizing hormone, the follicle stimulating hormone. It gets a little more complicated, but for practical purposes, most people respond to an increase in the total testosterone. So the testosterone is a lot of times a first line of defense. And some guys that are younger, guys that are having less of a dysfunction, will see results simply with the testosterone. They'll feel a little more substance in their pants and maybe a little more size, a little more sense of, guys will report it as tingling. And it's just a sense that the nerves are waking up, the sensation is waking up simply with testosterone. And that's a really easy, simple way to begin dealing with erectile dysfunction in men. The second level comes from what we call the E-drugs. Those are I'll use the brand names because those are most familiar. That's Viagra, Cialis, and Levitra. Their chemical names are sildenafil, tadalafil, and vidalafil. And I think of them in alphabetical way, STV. If you go on QRSTV, gives you those 3 medications. It's just my simple way to remember them. And they all have a similar time to functioning, usually within 20 to 30 minutes, 40 minutes. You may start to notice some arousal. Also, they have differences in their duration. So something like Cialis, which is Viagra, that was the first drug to come out, that tends to work for 6 to 8 hours. So it's a one-night drug. Something like Cialis, that may be a 3-day drug. That's one that will stay in your system for 3 days. And people respond differently to them. We use a lot of pharmacy. We use a compounding pharmacy for most of our products, all of our products, essentially. That allows us to also do mixtures of those combinations where we can use Tadalafil as well as Vafil together to get some of the early onset of action, but also a longer duration.
Yep.
And with the compounding pharmacies, they can also add a lot of specialty medications as well, which help with the big head, not just the little head. And I always say with men, with sexual issues, with performance, the mental side of things is often very important. If you're overstressed, if you are tired, if you're just not in the mood and you're trying to be in the mood, it can be difficult. Some of these other medications, like apomorphine, just helps relax your brain a little bit, helps get you in the mood for love. The other one that is frequently used in combination is oxytocin. And oxytocin is typically known as the love hormone. It's the hormone for bonding, for pairing. Oxytocin is very important in the newborn infant, bonding to the mother during suckling, during feeding and nursing. So oxytocin is that love hormone. We're able, with the compounding pharmacies, we're able to incorporate those medications as well as different combinations of the drugs to kind of dial in the exact formula, the exact preference, the secret sauce that works. By using smaller doses of some of the drugs, you can maintain some of their positive aspects without overdoing it on the negative side effects. So it's a good way to really dial in, I said, that secret sauce to what works best for the patient. And that's what I think guys want. That you could go to your family doc and he can write for this, write for that. 1, it's very expensive, especially if your insurance doesn't cover it. 2, it may not be the exact formula. We go into finer detail on what works for you and then modifying that as we go and utilizing some of these specialties.
Yeah.
The third stage of ED treatment, when you go from testosterone to the ED drugs, and I said we do the combination of ED drugs as well as a sublingual form, which increases the speed with which it's into your bloodstream. The next step is what's called they're Trimix. This is more of an injectable form. And guys get nervous when they hear the idea of an injectable form of a medication. But these are medications that come in an auto-inject package. So it's something like someone would have if they were to have a bee sting, and the EpiPens. You deploy the pen into the area, hit a button, and a 30 gauge needle, which is a very small needle, will go out and it'll automatically inject the material. And we're able, like I said, a Trimix. There's a lot of these began with what's called a Trimix, a quad mix. And I won't get into the details of the makeup, but each medication has a different function for both basically firmness as well as duration. So once again, this is a way that we can add 2 or 3 or even 4 medications at a time in various doses to increase your firmness that you're looking for, or to increase your duration. So it may give you an erection for a longer period of time. And these are things that we can test in the office, and then we can trial. And patients can use them. There's people that will say, I'm going away for a weekend. I'd like something that's a little more long lasting. Or if it's something during the week and you're trying to get to bed, you don't want to just do a quicker session, we can increase the firmness, decrease the duration. So that's a really nice way to dial it in. The interesting thing about the Trimix injections that I find is that it doesn't need the big head per se. This is something that works completely local within the shaft of the penis. And it's useful especially in like paraplegics, wounded warriors, guys who have spinal cord injury. That patient population is unable to obtain or maintain an erection, period, because of that lack of neurostimulation from the brain. But with these injections, if it's injected right into the area, they will get an erection from the medications. Dr. Hunter Hansen is our mentor down in Carolina, and he tells a story of a group of friends brought in their buddy, and they wanted to help him find a girl. And that they were able to do that for this guy with the injection. It is something that, these guys they come back from the war, they may have relationship issues, but this is one way to really solve that problem and maintain the relationship despite the hardship. So those are a lot of the three big ways that we have to do it to help obtain and maintain. The other way is what's called the P shot. And a P shot is something that's more in the realm of regenerative medicine. A P shot is an injection of what's called platelet-rich plasma. And what the PRP is, you may have heard of it, Neil, with a lot of athletes, sometimes with muscle injuries, with tendon injuries. The orthopedic surgeon or the sports medicine doctor will take the patient's own blood, spin that down, and then remove the red cells so that the remaining portion is the plasma. That's the white cells. That's the part of the blood that's loaded with those healing elements, cytokines and leans and a lot of the healing elements, but without the blood cells. So with the blood cells, that's when you're going to get the bruising. With the red blood cells, you're going to get the bruising. But when you're using just the plasma, it gives a regenerative effect to the tissues. So a P shot, we take the blood, we spin it down, we get about 5 cc's of plasma, and then we're able to inject that into the working parts of the penis, into the cavernosus and the spongiosus. Those are the erectile tissues. And with that, the PRP will go in and bathe the area and help to rejuvenate the area to improve erection, to improve size. Sometimes it also helps with what's called a venous leak. Some people may have an issue with maintaining the erection because of a venous leak. If the blood vessels are redundant, if the veins are redundant, there may be a persistent leak, which leads to that poor erection. So this is a way there is a solution for the problem regardless of what the problem is. And sometimes it may take a little trial and error, but often we can get an idea of what the issue is on the patient's exam and on their history. We try and nail down, and I've had this conversation a number of times over the past several weeks. Patients will come in and say, what is your main problem? Is it obtaining, maintaining, is it finishing? And if you go into a lot of the detail of what their issues are, you can often find the problem and then target the treatment to help resolve those issues. And it's been successful. Guys come back and they're like, oh yeah, doc, I'm much happier. The wife is happier. The relationship is better. Hey, I just had a buddy, I was golfing last weekend, and while I'm on the road, I had a friend call and say, hey, Jack, I need a couple more of those pills. I need some more of those pills. So once guys are in the door, in the system, a lot of these things can be handled over the phone. We get to the bottom line through a detailed exam and history. But then once someone is in the system, it's easy to call in and just say, hey, I need a refill on that. Hey, that worked great. Hey, maybe let's try something else. And until you get into a men's clinic where you're frequently dealing with these, I think it's very difficult to deal with this through a family physician because they're not going to take the time. They've got so many other issues going on that they just don't have the time to deal with the detail that we're working through. I think people are pleased with that, pleased with the results as well as the way to respond to the condition regardless of what it is.
This, just looking at, you give really something that I wish I knew earlier when you have those problems, especially looking at other people that have dealt with it at one point in time. You take them down a road versus right to medication. You really look at the root of cause and see if there are natural ways to do this. Also, it could be in meaning the big head. And you're able to educate people in this process and not feel embarrassed going to your family doctor. You're able to sit down with somebody that sees this, focuses on men and wants what men want.
Yeah, and the conversations, if you were to have this conversation, you wouldn't have this conversation with your buddies in college or with your buddies at the bar. And as soon as these are guys, I had a guy today, he's a carpenter. construction worker, carpenter guy. And once you go through it step by step, you explain the anatomy, you explain the physiology, you explain there's baffles and flooding of caverns and that increase pressure. These are all these are all concepts. These are physics concepts that most men understand, but they've just never had their own body parts explained to them in that way. It's something your father's not going to explain to you. It's something that men never get. You're not going to get this conversation in the locker room with your buddies that, hey, I've got a venous leak. Hey, my tissues are insensitive to testosterone. And you see the look on the guys' faces and they're like, oh, that's it? I thought I was defective. I thought I was weak. I thought I was done. But you're saying this is common. You're saying there's different causes, and you're saying that this will treat it? Yes. It takes that pressure off, especially the idea of I've talked to a number of guys about this, guys that use the injection. And that sounds, when you first hear about it, you're like, ooh, I got to give myself an injection for that. But the guys who've used it and tried it, it's a guarantee. You know what I mean? It's not, is this pill going to work? Can I have a drink with the pill? What if I have some wine? What if I'm not in the mood? What if that there's some variability with it? But with the injection, they know they're going to get an erection. They know, and once they get used to it, they know about the duration and the firmness.
They got to create that so that is a guarantee before you what if they could create the compound in a way that was a pill?
Yeah. And it eliminates the pressure. They can relax and enjoy their dinner or their date or their night out or their movie night, whatever it is. They can enjoy it without worrying about, I think we talked about this with Greg McClintock when we had our meeting with him. Yeah. And a lot of guys will admit that they're afraid to cuddle, they're afraid to get intimate because they don't know if they're going to be able to perform. With this, it gives you a little more, you can relax, you can cuddle, you can enjoy your time, your night off with the one you love and not feel the pressure of it because you know you're going to be able to perform if that's what you want. Like I said, when that hits the guys, when guys realize that I can relax, I can utilize the science to help me with the romance, takes a lot of pressure off themselves, takes pressure off their spouse, their relationship. See a lot of happy people with it.
Exactly. All right. So I think that you've answered so many questions. There's more things to think about in their next podcast when we get a chance to discuss things further, breaking down probably every one of these forms in a more conversational style. But people can go to the ultimatemensclinic.com and right now schedule a call with Dr. Jack today. Reach out in social media, DM him, let him know I want to talk to him, and you'll get that call going and be available to sit down with them, and hopefully they come to your clinic in New Bedford, Massachusetts.
Absolutely. We can do telephonic visits as well, but I think when guys are here eyeball to eyeball, it's just easier to talk to someone and gets it across. But we can do either. We can accommodate however you like.
All right. That was the special simulcast of the Neil Haley Show and the Ultimate Men's Movement, guys.